Hurricane Sandy crashing on shore, winds now at 90 miles per hour.
I was there the night and that it happened, and somebody called me to the window. One of the nurses called me to the window and said, you know, where's the FDR Drive? And I looked and I said, well, now it's the East River. I says, we don't have to worry about anything because we're up on the 10th floor. I tried to joke around, but it was almost like Mother Nature claimed what was hers and then gave it back by 6 o'clock in the morning.
My shift started at 11:45 p.m. So I told myself maybe my co-worker is going to need some help. When I was driving, the water was rushing, and next second, the water became up to my neck. And I was just able to get off from my car, and I had to swim to safety. Cornell Hospital was evacuated to Kings County Hospital. And people like me, some people lost cars, some people still without electricity, but every day we are coming to work.
I was working in the ambulance bay triaging, and we were at that time accepting patients from Coney Island and other hospitals. It was overwhelming, and I was panicking, but I couldn't let anyone see that I was panicking. Families couldn't find other family members. They were devastated. They didn't know if they were dead or alive, missing, drowned. So we were constantly trying to call family members, text family members, using our personal cell phones and whatever means we could to communicate with the outside world for them to calm them down.
Operating on backup generators since Superstorm Sandy knocked out power, New York's Bellevue Hospital Center was forced to evacuate patients on Wednesday.
I was in the ICU part of the emergency room evacuating our very critical patients. Our IV pumps weren't working, which meant we had to do everything manual. So if, for example, I myself had a patient on an IV drip and I had to manually count the drops that were coming down into the patient, making sure that that patient was stable.
It was scary the way that sometimes the patients, for example, they need to be intubated. Their breathing is not good enough. So if we have no electricity, we cannot use those the equipment that we use all the time. So we have to totally work and use different skills to help the patient survive.
We made a promise to each other saying, okay, we're not going to leave, and if we leave here, we'll leave together with an empty hospital, and that's exactly what we did.
It doesn't get more powerful than standing with some of the Bellevue nurses who effectively did the impossible when Sandy hit. That with no warning, with no power, they saved hundreds of lives under absolute duress. And they did it with extraordinary grace and teamwork. Not a single life was lost, and they deserve our eternal gratitude. Let's give a round of applause to everyone.
The pledge that we took after graduating nursing school was that we would care for every patient, regardless of their ability to pay, regardless of their ethnic, religious background.
Full knowledge of the obligation
I am undertaking.
I promise to care for the sick
with all the skills and understanding that I possess.
Without regard for race, creed, color, politics, or social status.
sparing no effort to conserve life,
to alleviate suffering, and to promote health.
I will respect at all times the dignity and religious beliefs
of the patients under my care, holding in confidence
all personal information entrusted to me,
and refraining from any action
which might endanger life or health.
I will endeavor
to keep my professional knowledge
and skills at the highest level. Cooperation
to all members of the health team.
I will do my utmost to honor the International Code of Ethics
of the Registered Professional Nurse.
Up until the 1870s, nursing was a truly despised line of work. You wouldn't even call it a profession, an occupation, and it was kind of like the lower level of domestic service. In Europe, Florence Nightingale had this vision of nursing as a profession, and she started in England, but in 1873, a group of women who were interested in Bellevue Hospital established, in effect, a Florence Nightingale training school at Bellevue for professional nursing.
You know, Florence Nightingale, everybody thinks of her as this woman with a lamp. But in truth, when you read what she wrote at the time, she was a statistician, and a lot of the work that she did with regards to gathering statistics and looking at, infection control standards, etc., her framework was a little bit more than, just keep the area clean. She actually did research and validated it statistically.
So this really transformed the public idea of nursing and even how nurses saw themselves. How Bellevue began was because of the city almshouse. In those days, if you were poor and the city could possibly support you in your own house, they'd do that. So who wound up in the almshouse tended to be people who couldn't take care of themselves. And so early in the days of the almshouse, 1736, they opened 2 rooms upstairs, which were for the very sick in the almshouse, and that is the official beginning of Bellevue. From then until really into the early 1900s, nobody who could afford it would have gone to a healthcare facility. The service was so low tech, any kind of medical services, that there was just about nothing you couldn't do in the house. And the danger of infection was so much greater in the hospitals because this is obviously pre-antibiotics, even pre-antisepsis. So everybody rich stayed home. You went to a healthcare facility like Bellevue, like pretty much any hospital, basically because you were poor and you couldn't work. When New York Hospital, which is a private hospital, opened in the 1870s, their ad said, "Surgery as safe as in the finest home." Gradually during the 1910, 1920, 1930, the private hospitals began to move into a more scientific mode, and gradually money began to be a bigger piece of the equation. You really have 2 sets of hospitals with 2 different missions. The mission of the private hospitals generally to do a good job for the patients they take, but they are not obligated to take everybody. That is not their mission. The mission of the public hospitals is to see that everybody gets care. The private hospitals had a terrible time during the Depression because they had generally been living off their endowments, which of course plummeted in value, so they weren't getting the income they were used to. They actually closed free wards in those years because they simply couldn't do it without going bankrupt. So they were taking fewer charity patients. They also had fewer paying patients. The private hospitals began experimenting by offering health insurance. Now, because the 30s were so hard-pressed financially, it didn't really take off in the 30s. It got started then. But after the war, it became, again, a passport out of free care, out of the public system, for a whole other category of people, which was basically the working middle class. From the 70s on, there was this feeling that we couldn't be lavish about public services. Public services were something that would be nice if you could do it, but after all, we can't do everything we want to do. And that really set the stage for the ideas that came along under Mayor Giuliani in the 1990s of why don't we just get the city out of the public hospital business entirely and turn all the hospitals over to private hands. Giuliani was defeated. Privatization was dead at the level of the whole hospital, but he did not give up on the idea of privatization. Individual services within the hospital system have been privatized, and that has kind of chipped away at this core mission, because the more services you have privatized, the more you have them under the control of agencies, often for-profit agencies, that don't have that commitment to the core hospital mission.
I think what we have to worry about in the future is the concept of privatization. And with privatization, what historically has shown is there's a loss of standards being met. And the idea of once you privatize something, who has access to it? Because now it's private.
It's really scary to see the privatization that's always knocking at our doorstep here in the public hospital system. They've already privatized our dialysis units.
Dialysis is a life-sustaining treatment for people who have kidney disease, renal disease. It's a procedure in which a nurse has to sit and watch the patients, basically blood being drawn from their body, be cleansed, and go back into their body. It's a lot of monitoring of hemodynamics, your blood pressure, your temperature, your heart rate, which needs to be monitored by a licensed professional. And also, you're on a lot of medications that help you sustain your life. Instead of registered nursing caring for patients on dialysis units, they are being outsourced by technicians who may not have as much vast knowledge that registered nurses do of anatomy and physiology and medications that are needed to care for these patients.
What happens when a private company comes in to operate a city service is the whole reason they're brought in is to quote unquote be less expensive. They want to pay them less and get the same amount of services. So where does that savings come from? The insurance companies are paying the same amount of money. The patients don't have any more money to give. So the savings comes from having less people take care of them.
When dialysis is privatized, these patients are not getting adequate care by licensed professionals. This has led to increasing death rates of these patients.
One of the things that worries me when I look at what's happened even just in recent weeks is that shutting down services is in essence a way to privatize some elements of our healthcare system. So when you shut down, for instance, a labor and delivery unit in one of our city hospitals like North Central Bronx, you're then saying that those patients can go to another city hospital, which has only a limited amount of beds, or they can go to a private sector facility, which is in essence privatization.
We have hospitals closing in Brooklyn. We have the potential of the loss of a level 1 trauma center in Harlem, and now this, right here in this community, the loss today of perinatal services. And demand that they keep open labor and delivery services here in the Bronx. We cannot afford for this mayor to close this facility, which would have an adverse impact on infants and women.
My wife is pregnant and she's due on this week. My first son is born in here too, so I'm really attached to this place. And now they're closing it, so we don't know what we're gonna do. I feel like I wanna cry because my wife don't speak English, and I don't know what she's gonna do. If she comes here, they always help her. This is crazy, this is outrageous.
You think about privatization, you think about say Mayor Bloomberg going on TV and announcing we're going to privatize the public hospitals. Much more subtly, what's been happening is, say in the emergency department, we have a very large number of nurses that are on paper temporary staff from a staffing agency, from a private staffing agency. However, they're used as full-time staff, so they work full-time hours, yet they're not on our contract, they're not on our union, they don't have any health benefits, they don't have any sick time, they don't have any vacation time. We often have problems with overcrowding. As a part of our contract, we're able to fill out a form that's saying we're protesting our assignment, you haven't scheduled enough nurses, what are you going to do about this because it's unsafe for our patients? We can all sign that. These folks cannot sign it because they're not a member of our union. If they're to speak up, they're in danger of not being asked to come back tomorrow.
This is a bad situation because they can be forced or even asked to do unsafe assignments, which can lead to patients being harmed or patients not getting adequate care.
It really bothers me working in a public institution to see this happening. And it seems like a trend that's increasing.
After graduating nursing school and taking the oath, I think now we're more than ever under attack with privatization, which totally would go against our oath for taking care of each and every individual, each and every patient.
As the system gets more and more complicated, and as the same patient is served by a whole collection of specialist physicians who may never talk to one another and may never see one another, the one person who is there and trained to care for the whole human being is the nurse. When hospitals are on short rations, everybody in the hospital suffers.
Since the city started outsourcing dietary and housekeeping to save money, it negatively impacted our patient and our patient care.
You wouldn't think these cuts would affect patient care, but it does. Nurses are now asked to go downstairs and pick up linen. Nurses are now asked to go downstairs and pick up food for their patient. This is cutting away time from the actual care that they give the patients. Nurses are asked to clean, which can increase infection rates, because if this nurse has just cleaned a floor, would you want this nurse caring for your mother or father?
If they privatize New York hospitals, what happens is that you're going to see a lot of patients out on the streets not getting cared for. The underserved, it's not going to be treated. You're going to have more infections. You're going to have more people dying, and it's not for anybody.
If the hospital were to close, a lot of people in the community would have to go very far to get service that we provide.
The way to move forward from the corporate power that is now controlling the healthcare system on the payer side is to move forward to publicly accountable and publicly funded and universal health coverage that cares as much about the wealthiest New Yorkers as about the poorest, because we would all be in the same boat.
One of the main reasons why we have been fighting a battle, and we hope to continue until we are successful in having 100% of Americans and visitors and others get complete health care.
I would like to see that all New Yorkers have the choice to have health care.
I think there should be Medicare for all and reversal of privatization.
The only rational solution is to have a Medicare for all single-payer healthcare system. Very simple. Less money, better outcomes, single payer.
People respect nurses, people love nurses, people understand nurses. I think the nurses of New York and the nurses of America can play an enormously important role in spreading the single-payer message.
We are strong unity. Look at us, NICERS, 1199, all the other unions that's involved with all the other healthcare workers. I think if we do bind together and be more stronger voices, we can make a difference.
Advocate, 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 and get involved.
As nurses, we not only care for patients in the hospital, we care for patients outside of our own personal hospitals. So by us coming together in large numbers, we are showing that we're not going to stand for a minimum patient care for our patients.
Now is definitely the moment for nurses and patients in our communities to band together and to fight privatization of healthcare.
We are definitely stronger together. Oh, definitely.
HAC nurses, we're going to band together and try to stop the closing of the city facilities. We stopped them from closing Bellevue, and we're going to continue with our fight to fight for the weak and the undocumented and the old and the frail.
We're not for profit, we're for care. We care for our patients. That's what's most important to us.
We're lucky in New York that we're organized into a union, the New York State Nurses Association. When nurses move into action, we're the sleeping giant.
What's it all about?
Patient care.
And they say cut back,
we say fight back.
I've always wanted to help other people, sick people. So I decided that is where I'm going. So my journey in nursing has been a nice one.
A little girl, 6-year-old girl, ran into the front main entrance of the emergency room and said her mom was having a baby in the taxi outside. and we had to deliver the baby in the taxi. And I was so nervous. And first time delivering a baby, and it was, when I heard that baby cry, I couldn't believe it. I had goosebumps all over me, and I cut the cord for the first time.
My sister has a psychiatric disorder, and back in the 70s, the treatment and the therapy was very different than it is today, and I learned a lot from that and what I didn't want repeated to other people. So I wanted to get into nursing, specifically psychiatry.
Well, my mother was a nurse, and she taught me how to take blood pressures, temperatures, pulses, all that good stuff. When I joined the Army, I wanted to be a military policeman. I was too young, so made me a combat medic, and I liked it. And 24 years later, here I am.
I wanted to actually give of myself because I actually had a friend who, committed suicide, and I wanted to, provide the service that I could for, the people to prevent such a thing from happening.
Many years ago, I was growing up, my aunt was a nurse. She had this navy cape with red inside, and she had the white starch uniform and a little hat. She looked fantastic, and I said, oh, I want to wear that uniform. Funny part is, I'm a behavioral health nurse, and I don't wear uniforms at all.
I am definitely proud to be an extension of what was in the past and moving forward.
I think it's awesome being a part of the healthcare tradition in New York City. When you look at Bellevue Hospital and figure that all this has come from there, and I just think that it's a shame that, all these great strides that we've made in healthcare, taking care of New York's sickest and poorest without regard to their ability to pay, that's threatened. I think it's a shame.
I feel proud to be part of that tradition, and I feel privileged to be in a position where we can have a fighting chance at saving public health care in this country.
As a nurse, and things seem to be overwhelming, the most important thing, I believe, is to stay calm and collected.
And smile. Keep on smiling.
Yes.
Inside your heart and outside. Because that makes the patient even more thankful for what you do.